Hi, this is Leif from the Pain Relief and Wellness Clinic, and in this video I thought we'd talk a little bit about the meniscus, which is a small piece of cartilage in the knee on either side, which provides a bit of cushioning and stability. Sometimes these cartilages get injured or even ruptured, usually through some sort of torque type injury through the leg. So if you have the hinge joint and the knee kind of hinges this way, the cartilages or the meniscuses sit on either side of the condyle, and sometimes you might be running, your foot gets stuck and you might twist and there'll be sort of undue torque load on there. If it's bad enough, you'll probably need surgical intervention, but if it's just a moderate or minor sprain, using some conservative treatment like massage, physio, acupuncture, and all that sort of those sort of musculoskeletal treatments might be enough to get you to heal and recover. It is a pretty slow process because cartilages have poor blood supply, so you will need to be patient. And I thought I'd run through a treatment rationale and point combination for doing acupuncture on meniscus type knee injury. So I hope you find value from it, and might be helpful for some of the patients that you treat. Thank you. Okay, so I'm going to run through a bit of a point selection for a medial meniscus pain, or maybe a little sprain. You know, if you have something serious, then possibly you need to get it looked at through some MRI scans and maybe surgical intervention. But if it's just a minor tweak or it's an ongoing kind of niggle, this might be a helpful treatment. So I like to use the actual point on the meniscus and do oblique needling down, so you can feel that in between the two condyles. If a little space, and then you can do associated 2 points on either side just to support. I like using spleen 9. We usually do 2 of those and run electric. It's always a good point for the knee, and it's sort of the extended fascia of the patellar tendon, and the muscles that attach all around the knee flow down here, so usually has a good effect. Spleen 7's a good point for moving fluid and the lymphatics. So if there is any kind of swelling, it'll just help shift the fluid. Kidney 7's always good for bones, sort of knee problems. And also kidney 6, another good tonifying point for the knees. So a lot of the kidney points do have a good effect on taking osteoarthritis and sort of pressure off knee pain. You can also use the knee eye points, so stomach 35 and the associated medial knee eye. You can also use stomach 36. Again, it helps take pressure off the patellar tendon and the quadriceps as the fascia and the attachments come down to the tibialis anterior. You can use stomach 34 to take a bit of pressure off the opposing muscle group if there's a bit of tightness coming from the ITB, or there's a bit of a lateral pull on the knee. You can use spleen 10, so always a good point for vastus medialis, help release that. Here I just found a couple of RC points, some sore points. So any of the kind of tender ones that you find in the area are worthwhile needling and maybe putting a bit of electric through. Also, sometimes be worthwhile chucking in some of Tong's points that run on the inside of the leg on the liver channel. Again, sort of helps promote lymphatics and take pressure off the any muscular tension that's running down to the meniscus. Now I'll just go ahead and needle those points. So you can see a nice oblique angle. You feed it down next to the meniscus. You don't want to needle into it. It's not comfortable, it doesn't feel good, and you might irritate it. And this sort of treatment's good too when maybe sort of physio or massage technique might be a bit too acute and angry at that point. So this is a good way to take pressure off, get some work done without causing any further aggravation. So then we're doing spleen 9. So that's straight in the joint. You can angle it upwards to the stomach 35, so the opposite knee eye. And I like to run 2 on spleen 7. So kidney 7. Can give a bit of buzz on this point. It's not uncommon to feel a flash run down into the toe. Kidney 6, it's obviously quite bony down here. I like to needle it back towards the heel, again quite obliquely. Another point I forgot to mention is kidney 10. Kidney 10, liver 8. Again, can be helpful. So the knee eye point. Stomach 35. So just take a bit of care, be careful with those ones. You can needle reasonably deep, but you don't want to be going too far into the capsule or, you know, making it uncomfortable. Stomach 36. We've got stomach 34 at the top. Spleen 10. This also can give a bit of a jump or a jolt. It's a strong muscular end plate junction there. These are the tongue points. And then these were just Arshi, they were tender. It is quite bony here, so I'm going to needle them in the same oblique fashion as the meniscus points. Great. So this is a pretty good, there's some basic points to use on a more of a sort of traumatic injury. Obviously if there's a deficiency pattern or an overuse pattern or another systemic pattern, you would use extra points in the body to address those systems and organs and channels. But if it's more of a sporting accident, using some of these points or the selection of them should give some relief. Then also, just to top it up, I like to use a bit of electro. It usually feels good, especially around the joint area. If someone feels the point strong enough, it's not a compulsory thing. They've got to be able to relax into the treatment, so if they're already feeling these points strong, then there's no need for the electric. But maybe if they come back for subsequent sessions, electric can be good. So here I've hooked up some of the more important points for the electric. Like I said before, I like to run through the meniscus points. I've got spleen 9 here. I've also done the 2 knee eyes, and I've done the Aishi point up here. I like to turn them up to a moderate medium, so you feel it, but it doesn't have to be so the whole leg's jolting. It should be quite pleasant. And then kick back, relax, and usually at least 20 minutes with the needles in is good. And as the injury progresses and becomes better, you can start to apply more, massage technique or a bit of a rub at the end. Obviously trying to move any fluid and lymphatics up towards the body, and sometimes it can be important to release the opposite side of the leg, so the outer side of the leg, more than hammering the inside. And then obviously communicate with your patient, client, just to find out what their tolerance level is, and hopefully it should be springing down the street. So to summarise, I actually did use this treatment on myself when I landed a bit funny in the foam pit while doing some trampolining, and it was pretty sore initially, and I did have reasonably good range of motion, so I kind of knew it wasn't too bad, but it took a little while to heal, so I ended up doing repeating this treatment 3 times within sort of a 2-week period, and then after the 2 weeks I was okay enough to go back, and since then also been training on it at the gym, and just a bit cautiously. You just want to make sure that you've got some awareness when you do train, and not to train through undue pain. Obviously, it can fire off, and now I'm pretty much pain free. It's 90% better, but I still feel under certain due stress. It does give me a little warning sign, so it's probably going to need maybe another month to be properly recovered. But as far as now, it's no pain. Okay, see you on the next one. Bye.